when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh, yeah.
He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high pressure.
This apparently was a police pursuit and has resulted in a head-on collision.
The pain score's 10 out of 10. She's got lumbar back pains.
If it does hurt a lot, shout out and we can give you some more, OK?
High emotions.
It's always in the back of your mind when a helicopter were to crash.
The last thing he wants to do is go in another helicopter.
He's gone.
He's shaken up.
Yeah.
And he's very, very upset.
And high drama.
So he had chest pain, then he arrested.
Yes.
We had two guys who were first aiders and they gave him CPR within a couple of minutes of him being on the floor.
It's rush hour in Yorkshire, and at Air Ambulance headquarters, reports are coming in of a crash in the suburb of Driglington.
Head-on collision following police pursuit.
Do you want to just set off on it?
Yeah, I reckon so, yeah.
Pilot Jeff has Helimed 99's twin jet engines running.
Right, shall we act like shepherds?
It's a 10-minute flight to the scene of the crash.
The initial details came from the police. This apparently was a police pursuit and has resulted in a head-on collision with patients trapped inside the vehicle. So working at night in the heavens environment is an interesting one. But of course, there's the aviation aspect of it, getting there, and Jeff and Paul are working hard up front now to get us there safely. Once we get on scene, of course, we lose a lot of the visual clues in the daytime. We've got torches, but in the dark it's very easy to miss bleeding and things like that, especially in footwells of cars. So we have to be particularly careful to make sure we examine the patients very thoroughly.
Got like a little...
See Andy with light.
Little track.
Where are you going in the field? Yeah.
Yeah, you've got a little track on the far side of this field.
That's the extent of the hizzle.
That's fine, mate.
OK.
Paramedic Paul's using the steerable searchlight to spot a place to land.
Landing the aircraft at night is a slightly more complicated operation than during the daytime. There's a set way that it's done, the front seat paramedic controlling a scene light. We've pre-identified a landing site. We do a circuit 1,000 foot, then 500 foot, and we've got some fairly sophisticated mapping that allows us to see any wire hazards, because at night that's one of the big hazards for helicopters, is not being able to see wires.
Pilot Jeff's also using night vision goggles to see the field they've chosen.
I've got the last options.
What's that?
It looks like it's a bit wet, guys. So,
Yeah, right.
How's the tail looking through the...
Yeah, I've got eyes on, it's looking good currently.
Cheers, thank you.
I'll let you know when we're settled.
The crash happened 20 minutes ago. Police BMWs were trying to stop a high-powered Merc.
Hiya, how are we doing?
Police have been in pursuit of this Mercedes.
Yep.
The occupant of that legged it across the field.
Oh, right.
Two in this small car.
Yeah.
Husband's got out, extricated himself, and been walking around. He's now in that other ambulance, looks okay.
Okay.
But he's whined for significant lower back pain.
Yep.
The driver fled after a head-on impact with an innocent couple in a hatchback.
Collis fracture here.
Yeah.
And a wrist deformity.
Flying Dr. Steve and paramedic Andy will take over the care of Sonia Staker from the ambulance service heart rescue team.
What's rest rate been like?
Rest rate's normal, 16 to 18, absolutely fine.
Yeah.
Got a fractured wrist on this side.
Yeah. And back pain, haven't we?
And chest pain now.
Chest pain now.
Listen, you were landing, so we're hard to tell.
Yeah.
And she's shallow breathing, so I can't really...
All right, okay.
It's a chilly night and Sonia is freezing. She's trapped in the passenger seat. Her husband Stephen was able to walk away.
Her pain score's 10 out of 10. She's got a lumbar back pain.
Yep.
Complaining a bit of pain in the chest, but shallow breathing, rests for about 16 to 18 apparently.
Okay. SATs are good on.
Good radials. SATs, well, if she's a bit cold anyway, I think it's the pain. So they can't get a line in.
Okay.
So I'm either thinking of going down, giving her some Odomorph, or something that might work a bit quicker, such as intranasal ketamine or fentanyl. I'm just wondering which, because obviously you've got your fentanyl. I'm not sure.
Either fentanyl or we can put a line in.
Steve wants to be able to deliver pain-killing drugs into her bloodstream, but the cold is making it hard to find a vein.
Steve's going to have a look for a line. If not, then we can go intranasal.
Hello there. I'm Steve, I'm one of the doctors. Okay, can I borrow your hand there, my love?
Sonia and her husband had been out to buy a kebab. They were a 2-minute drive from home.
Are you allergic to anything?
I always went to that side.
Okay.
Is it hurting second deep?
It might be a bit overpowering.
Whereabouts? Along your sternum.
Sorry. Right, we'll get you that pain relief in. I think Andy's just drawing up some morphine over there. Get some in and then we can crack on. I understand the middle of your chest quite sore, down your breastbone, is it? Yeah.
Sonia is also in great pain from her back. It's a worrying sign. And there's danger of internal bleeding.
How are your legs feeling? Sore. You're feeling generally bruised and battered though?
We're not allergic to anything, are we?
No.
Morphine there, mate.
No, she's very well.
We'll start with some morphine. Have you had morphine before? Yeah. Yeah, okay. So it can make you feel a little bit woozy, but it'll take the edge off that pain.
They're about to move her, and it's going to hurt.
Okay, there's 5 of morphine in. Have we had any TXA in? Nothing. All right, shall we get some TXA, Andy?
TXA is tranexamic acid, a drug to reduce internal bleeding.
Right. You're scared. You're going to be fine, okay? We're all here with you to help you out, okay? Has the pain eased at all? Okay.
I said the chest was clear, but she's got sternal.
Sternal pain, yeah. So plan for extrication, is it backslide or? Okay. Fine. Okay, I think we're in a position that we can start doing that. What's your first name, by the way?
Sonia.
Sonia. Okay, Sonia. What we're going to do is going to make some space, and our colleagues at the fire service and the heart team are going to get you out of the car now, okay?
Her rescuers must keep Sonia's spine immobile. Her back pain could be the first sign of a life-changing spinal injury.
I've got some more pain relief. If it does hurt a lot, shout out and we can give you some more, okay? But I'll clear out and let them do what they're best at. Okay.
The driver of the Merc has vanished. Police are hunting him, but the air ambulance team would like to find him for a different reason.
The patients in the car that obviously has been a result of the RTCs are quite significantly injured, so the driver or occupants of the Mercedes could equally be just as injured, so it's quite important, even though they have run away from the police, it's important that we find them because they may well be injured themselves. We've got to treat them just the same as every other patient, no matter what they've done, whether they're guilty or innocent.
Dr. Steve and Andy are taking stock.
We're not looking at any
nothing immediately
abnormality with chest, just a little bit of pain across sternum.
Yeah, I think
low back pain and fractured wrist, obviously.
Yeah, she's sore enough to warrant giving some TXA to, I think.
Yeah, with regards chest and back.
Chest, yeah.
Okay.
Yeah, hook her up to the monitor and send her off. If one of the heart lads wants to go in and titrate some ketamine for analgesia as they go, they can.
I'll have a word with the assault crew.
Yeah. And the fire service are now working to get her out of the car. Fortunately, she's conscious, but she has got a lot of pain around her back. So we're going to leave the fire service and the heart team manage the extrication. Once she's out, we'll give her a check over, check there's nothing immediately life-threatening. And if that's the case, then we'll be able to get her to Leeds on one of the ground ambulances.
Sonia's condition is stable for now, and the accident is a short drive from the Regional Trauma Centre at Leeds General Infirmary. She's being strapped to a rigid scoop stretcher to protect her back.
You happy for me to speak to the police, Gaffer, at a minute? If you guys are... Yeah.
Police dogs are on the scent of the car driver. His victim, who looks after children with special needs, will almost certainly require surgery, and fears are growing she may be bleeding internally.
Sonia, I'll give you another blanket, all right? Yeah. It's free on the NHS. We don't charge.
So having a little look at your tummy. How's it feeling oppressive? What side?
Is that your hip that's hurting?
You think
It
what?
hurt on the right, but then I got pain on the left, on my hip, down in the bum area. Oh yeah.
Down here.
Oh.
Copy some tape.
Was that on a hip, mate?
No, upper quadrant, right.
All right, yeah. So that's a good reason to give TXA as well, isn't it? Yeah, you don't just job that.
Yeah, I'll take
She's just got a bit of pain right upper quadrant. Are you happy?
Yeah,
I'll
the
get
only
that.
thing I want to do, I know I'm being pedantic, you can go, somebody else can help me, I want to pod her.
The crew are happy to take her into Leeds. It's only 10 or 15 minutes to Leeds General Infirmary, which is a major trauma centre. So we've left her with the crew and hopefully get her patched up in the hospital.
Right, I'll leave you to it, guys, all right?
Thank you.
Have a nice night.
Helimed 99 is heading back to base. But in the streets below, the hunt for the thief goes on. His recklessness has led to injuries that could leave Sonia permanently disabled.
Call Silver Delta, final runway 28, second go.
Britain's skies are home to a growing fleet of helicopters. More than 1,200 of them are registered in the UK, but learning to fly them isn't as easy as the air ambulance pilots make it look.
You're going to Sherburn, there's a helicopter crash.
Pilot Scott must get his medics to the scene as quickly as possible.
They were just saying that he's actually landed, he's got out, but the callers told him to sit down and stop moving, so he's actually got out and they were walking him out.
But the pilot could have serious undiagnosed injuries.
But has he crashed or landed? Yeah, okay, alright, well, that I'm unsure about. Right, I'm waiting for checks when you're radios and lights. Right, I want Sherburn really, because we're not going to speak to anybody else, and it's quite a short hop. Auto trim and brief.
Dr. Bryan is on the case.
The brief will be up, back to the circle, then it'll be a VTOL departure out of here. Everybody happy? Yep. Okay, left end. Tail's going to come round to the right. I've got the other helicopter there. Try not to fly over the top of him. Just point that way.
It's always in the back of your mind what would happen if a helicopter were to crash. We were in a near miss a couple of weeks ago where a drone nearly crashed into this aircraft and would have taken it out. There's one in the last couple of years which actually had a fatality at it. So yeah, the thoughts are always in the back of your mind and try and push back as far as you can really. Hopefully there will be no fatalities or injuries. This one, as I say, the pilot seems to have landed.
Scott's heading for a small aerodrome that's home to 2 busy flying schools.
And it brings it home the fragility of what we do here, and the fact that at any moment something terrible could happen to the aircraft. But we rely on pilots like Scott, who's had 30 or 40 years flying for the military, to get us there and back safely.
We'll see if Lee's got any updates. S198's a couple of minutes to run. Any further updates?
Yeah, I've spoken to Sherburn again. The patient has...
Report got a minor head injury and the helicopter's basically tipped on its side. He's got out and walked. He's now in Heald's Aviation Clubhouse.
That's all understood. That's fine, I'll just do a normal join. We've got 2 minutes to run. I think I can see the aircraft now, it's just this side of the windsock. Yep.
Sherburn, Helibed 98 Alpha. Helibed 99 Alpha, Sherburn.
Helibed 98 is finals 28 grass right, and then I'll have a taxi across.
The £250,000 helicopter is lying on its side, its rotor blades bent or missing.
I guess one of the things you've got to consider is the last thing he wants to do is go in another helicopter.
Yeah, absolutely. Alright, I think that's probably as close as we want to get. Out there, if you're all happy.
Yeah.
Okay, leave us down, you are, cleared out.
Dr. Bryan and paramedic Rachel are heading out to find their patient.
Hi.
His flying instructor is meeting them.
He's gone.
He's gone?
Yes. He's shaken up.
Yeah.
And he's very, very upset.
Right.
But he's not injured.
Okay.
Has he gone home? Has he driven?
I don't know where he's gone yet.
He's got a bang on the head, hasn't he?
He's got a bit of a bump. Yeah, I didn't want him to go at all.
A head injury could explain the pilot's apparently bizarre behaviour.
But it's also about his safety, isn't it?
Well, that's what I'm concerned about.
I think for his safety you should let people know.
I agree.
The difficulty is he's bumped his head, and his head injury might lead to him being a bit confused. So we're concerned about safety, not just for him, but of others in the roads. So Matt, I think, is getting in touch with the police to see if we can track him down. So that's where we are at the moment.
He's, he said to the chap, "Oh, I'm just going to go to the toilet," and then he's done a bit of a runner. Left his phone and everything. So I'm wondering whether we just ought to inform the police.
Rachel's been trying to find out what happened. It might provide vital clues to the pilot's likely injury.
Yeah, apparently he's landed and then something's happened and it's flipped over. So that gentleman said it's become like a dynamic rollover.
Our main concern is that everything's kind of out of character. He's quite upset, but he's then just gone and left the scene and he's driven home.
Helmet 98 from the air desk.
Go ahead, Lee.
Yeah, Rich. I've informed North Yorkshire Police. I think they're going to send a unit down to investigate a little bit further, especially since there's less than mobile phone.
The brain is very sensitive to change, and if you have a bang on the head and it starts to swell, everything inside is affected. So it can change your behaviour, it can change your temperament. If he has had a nasty bang to the head and his brain starts swelling, that's when he can become unconscious, and even more seriously, it can kill people. And if he's driving at the same time and that happens, then the worst can happen and he could kill somebody else.
With no patient to examine, the team can do no more here.
If there's nothing left for you to do, guys, you can come clear.
Yeah, Roger, will do.
Helimed 98 is heading back to base.
Let's go.
Leaving behind a mystery and a reminder of the dangers posed by helicopters. "15 miles away in Bradford, one of the team's patients is struggling to recover from her injuries. Sonia Staker is suffering from PTSD after a head-on smash with a stolen Mercedes.
I remember the lights coming towards us, and then I just remember waking up afterwards.
Her husband Stephen escaped with a broken elbow.
I looked across at Sonia and I says, "Are you okay?" And then it was like a deafening few seconds, because I didn't know if I'd get response. And I says, "Are you okay?" And she says, "Me back, it's me back."
I broke my back in 4 places, had a burst fracture on my lumbar, so that's still ongoing. I broke my sternum, some ribs, both my hands, my thumb. Severe bruising and swelling to my heart and lungs with a partially collapsed lung, so I'm lucky to be alive, really.
Hi ho, hi ho. Off to work we go.
The crash has changed Sonia's life. She used to do karate and swim marathons. She now has limited movement in her arms.
I've only got 50% of the vertebrae left now, so we're still now keeping an eye on that and hoping it's started to fix together now, but the scans will tell.
The driver of the Mercedes has a lot to answer for.
I don't think I'll be able to forgive him because he just ran off. At the scene, he left me stuck in the car and he just got out of his car and ran off, and that's something that will stay with both of us forever, really. That's the part that I'm annoyed with, really, the fact that he just left us, well, he left me to die.
The only thing that's predictable in life is that it's unpredictable. I think that's the thing to take away from this. You don't and live life for what it is. Live it for today, for tomorrow. We don't know what's going to happen on Sunday.
I love my gardening, I love doing swimming, I love walking, and those things I can't really do at the moment, so I'm a bit scared of that, to be honest, but I'm trying my best to be positive. Fingers crossed.
The Mercedes driver has since been identified and interviewed by police. In a brickworks in South Yorkshire,
Listen carefully and I'll tell you how to do chest compressions. Make sure he's flat on his back on the floor.
a life or death struggle is underway.
1, 2, 3, 4. 1, 2, 3, 4.
Helimed 98's about to join the battle.
Yeah, it's with 3 all the rest in Haworth, Doncaster. There's nobody on scene and their Helen's not available.
Paramedic Matt and Dr. Chris are on their way. Ground units are also racing to the scene.
Yeah, it doesn't sound good, does it? Chest pain first.
Dispatcher Tyrone is listening in on the 999 call from shop floor first aiders.
Yeah, we've got brothers and sisters, I can hear them now, they're coming. You can hear them, great. Okay, just let me wander there with you and I'll let you go. Tell them to keep doing CPR till they're right with you. Yeah, right, they're right here now.
Ground units are now on scene. The helicopter is just minutes behind them.
The evidence is that people who don't have chest compressions early do far worse. You need to buy time doing chest compressions to get blood to the brain. Without those, most people die. So we're big supporters of everyone should be trained in being able to do CPR, because it can really be a matter of life or death.
The works is close to Doncaster Airport.
There's the airport, just directly left now. See it?
Yeah.
But it's a difficult place for pilot Gary to land.
Road underneath us, right hand side of the road, brickworks, yellow ambulance in it.
Yeah.
Are you two behind a canopy?
Right, it's going to be very dusty. Close all your vents, make sure everything's closed up. I'm going to go over here where it's safe.
Yeah.
I'm just going to keep flying around until I've trashed everything. Everything's blowing away from us, so we're alright. We're okay left. Good left.
He's inching the helicopter down into a goods yard full of stock, lorries and workers.
Okay, now.
We're down.
9-8,
Right, Rich, out you get quickly. Go, 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 go. The people are running around like headless chickens.
The works first aid team saw a driver delivering a load from Cumbria collapse.
So he had chest pain, and before an ambulance came and then he arrested?
Yes.
Okay.
What time did he actually collapse then?
I think it was about... Well, he came, he said, can I use your toilet? Come back downstairs, and he felt a bit dizzy.
Does he not work here, no?
The ambulance crew have shocked Dave Hutton's heart back into rhythm and strapped him to a machine that delivers CPR automatically.
A 53-year-old male started with chest pain, then had a witness collapse, started CPR about 11:30.
Yeah.
We've got here about 10 minutes later, CPR was in progress. He's had 3 rounds of PEA, we've just given him 2 shots in VF. He's had 2 lots of adrenaline since then, popped in an airway, got him on Lucas, got some IV access as well.
Dave's unconscious. Dr. Chris's mission is to keep him alive long enough to reach hospital.
So adrenaline was given...
He's had 2 lots of adrenaline, 2 shots of VF, 3 rounds of PEA.
So first rhythm was VF, was it?
He wants to use a chemical hormone to help kickstart his heart.
Okay. Do you want to get adrenaline ready? Is that all right for us, potentially? You happy to control the Lucas?
Yeah,
sure,
right? Yeah.
Yeah, so do them check now.
Happy?
Yep. So he's got a pulse there to feel. Good. And that could have and his CO2 is 6. Yes. Good. Yeah. And he's doing a little bit of breathing. Okay. Fine.
But his heart could stop again at any moment. Staff saved his life.
He had a pain in his chest, so he came up to our area here to go to the toilet. He came down the stairs, he came down with our first aider. We sat him on a chair and said, look, just sit there, we'll get an ambulance. He seemed okay to start breathing, then about 20 minutes later he got a big pain in his chest and then he fell off the chair, landed on the floor. We had 2 guys who were first aiders and they gave him CPR within a couple of minutes of him being on the floor.
Okay, so the situation is we're post-ROSC, airway's all right, breathing's all right, circulation's currently stable, we're checking the blood pressure. I think he's hypotensive. So let's give him some fluid, get him on a scoop and a trolley in the shade over there. If he wakes up, we'll do nothing and we'll just maintain his airway. If he doesn't wake up or he needs an RSI, we'll RSI him.
They're preparing to anaesthetise Dave, a procedure called an RSI. Some victims of heart attacks suffer life-changing brain damage, and this could reduce the risk of this happening.
Ready, steady, lift. Lovely.
So we'll get the beat. Rachel's doing the cannula. Once you've done that, BP cuff back on. I'll start setting some stuff up for an RSI, because I may as well, because I'm free. And then we'll crack on. Happy?
Putting Dave to sleep will protect his brain and reduce the strain on his ailing heart.
Sounds like he's had a heart attack and then he's had a cardiac arrest. So we've got his heart beating again, he's breathing a bit, but he's unconscious. So we're just going to formally secure his airway by putting a tube through his vocal cords with some drugs. So we're just setting up to make sure that can be done as safe as it can whilst Matt looks back his airway.
They're turning a warehouse into an operating theatre.
So we're going to give him a quick anaesthetic to get him a bit more stabilised. So we're just going to go through some checks and things just for now. Okay, so this is an emergency anaesthetic. We need a bit of quiet. Just only shout up if there's any issues. So Matt, you're going to give the drugs and have eyes on the monitor. Rachel's assisting me. I'll be the intubator. You guys, other guys, just shout out if there's any problems. Happy with that. Plan A is to tube him. Plan D is to stick the side jaw back in. Plan C will be for basic airways, and Plan D will be make a hole in the front of his neck. Is everyone happy with that? Sure. Any concerns before we start?
They're paralysing Dave with drugs to stop him breathing.
Floors in. Flushing that through. Midazolam next.
Yeah, the full 5 midazolam. So this chap's breathing is going to stop and become a lot slower before that.
Okay, 60 seconds.
Starting.
Who's timing? Lovely, thanks, Rach.
Once he's sedated, Chris will slide a tube down his windpipe so the team can use a ventilator to breathe for him.
Tongue piercing, didn't see that. Sorry, give me it back. Did that go through? Yeah, bougie out, 22 at the teeth. Good, that's 4. Okay, so that's a 97. Good, and we are on oxygen. Okay, you can release that, mate. Okay, fine. I'll get that secured in whilst you do the cuff. Actually, can you just hold that whilst I get it secured? Right. Okay, so get him on our monitor, we've done our ECG.
Dave's heart is still beating, but he could arrest again at any moment.
Matt, can I hand it over to you just for a second whilst I...
Yeah, no problem, we'll sort this out.
Chris wants to alert doctors at the cardiac centre in Sheffield.
Hi, it's Chris Srinivasan, one of the doctors with the Air Ambulance. Can I discuss a patient with you, please? It's a man who's had a cardiac arrest. That was about 11:05. He collapsed at 11:30, and he got a ROSC at 11:55. Yeah, that's great. All right, cheers.
Dave's been booked in for an operation to surgically remove the blood clot that caused his heart attack. But his condition is critical, and he may not be suitable for the procedure.
Right, so what we'll do, guys, is get him halfway and then plug our Oxylog in. Just swap him for Ventipack. Yeah.
There's signs that he's having a heart attack on his ECG. So the priority is to get him there and get him to the place where he needs to be, because he needs an angiogram where they put a catheter in the groin to open up that blood vessel that's blocked.
Time is of the essence.
Ready in? Okay. Yep. Yeah. Let's watch that tube in.
Got it.
Engines both supply.
Fine, Gordon.
Confirmed. Doors and harnesses.
Front skip from right. Doors and secure rear. Moment, so I'm going to lift. Bring the nose down to the right. Take off back into wind. There's not much wind, to be honest.
Yeah.
Pilot Gary will have their patient in Sheffield Northern General Hospital in just 10 minutes.
So when we'd arrived, the crew had done a fantastic job. They'd done everything that was required of them. The machine that was working on the gentleman's chest was what's called a Lucas device. Essentially that was performing chest compressions for them so their hands were free. On the next pulse check, we found that the gentleman had a pulse and he was trying to take gasps, breaths himself. So essentially they'd shocked his heart back to a rhythm that would sustain life. And he was trying to take his own breath. So what we've essentially done is continue the good work that they've done. When we've done an in-depth look at his heart, we can see that he's having a myocardial infarction, which is basically a massive heart attack, which has probably caused him to arrest in the first place. So we're heading to what we call a PPCI centre in Sheffield, which is hopefully going to rectify that by putting stents in his heart.
Dave is heading into the cardiac unit. His life is in the balance, and no one knows if the half an hour he was in cardiac arrest has caused lasting brain damage. The siren is sounding at the Nostell Air Base.
All to the side though. Right in RSI. Crews have only just found it. Tractor's gone over with a trailer on. He's got a serious head injury. Okay. Silent chest to one side.
Dr. Sarah, with paramedics Paul and Adi, are being scrambled to a farm accident.
Doncaster Radar, good morning. I had 9 Alpha. 175, Finish fine.
They're going to a tractor that's overturned. The driver seems to have deteriorated, has a head injury, a reduced level of consciousness and a chest injury. They're saying he's got a silent chest on the one side.
The patient has the symptoms of a collapsed lung. If so, the team must act fast to save his life.
If he looks like he needs that decompressing, do you just want to put a needle in that straight away?
Yeah, of course.
Just so that we can get a little bit more time.
The scene of the accident is a village close to the Humber estuary.
That's from 99 with visual scenes coming on.
Pilot Jeff is circling a country lane where a tractor and trailer have crashed.
Watch your foot as you get out, because this looks like it's just been roughly ploughed, this field.
Yeah.
He's been carrying this trailer in the tractor. Someone's come and overtook him. He's lost control, tipped the trailer over. He's then hit his head, and I believe he's gone unconscious, because there's reports that he went round the field and then came to a stop there.
Yeah, it looks a bit peculiar, doesn't it?
Yeah. When we arrived, he was quite dazed. Probably GCS about 12. He's got a GCS 15 now, but he does have an extensive head injury.
Injured driver Jim Jefferies is in the back of an ambulance.
Hello, what's your name? Jim? Eddie, nice to meet you. Do you know where you are, Jim?
Roughly.
Roughly. Tell me.
Ambulance.
What hurts the most?
Left arm, sorry.
Your left arm. Okay. How's your head?
So.
Can you open your eyes nice and wide? Can you see me okay?
Yeah.
All right.
Reports of breathing difficulties appear to have been wrong. The farmer's son rushed to help him after a motorist saw the crash.
Basically, we've been leading straw this morning. I got a phone call off Jim, or off his phone. I said, what's happened? Straight away I knew something had happened, because obviously Jim wasn't on the phone. She said, Jim's had an accident. She said, I saw everything, but she said, I've rang the emergency services. He seems to be conscious, but he's in and out.
He's crashed and then banged his head, or did he pass out?
The car's overtook him. Sorry, car's overtook him.
So he's lost control. His trailer's come over, and then he's banged his head, being confused, gone for a little drive around in circles, and then ditched it.
Okay, so it was sort of a minor issue and then a major issue.
Yeah.
The details of the accident are muddled. Dr. Sarah wants to make sure that no injuries are being overlooked.
How are you feeling now, apart from being in a lot of pain?
Just in pain.
Is it that arm that's the worst thing? If it wasn't for the arm, would you feel not too bad?
Yeah, not too bad.
A bit bruised and battered.
Sarah is optimistic Jim's symptoms are simply caused by concussion.
It looks like he's definitely banged his head and he's hurt his shoulder on the left-hand side, which is really uncomfortable. But he's able to talk to us and all of his observations are really good. So we just need to get some pain control, really, and then get the best way of getting him into hospital, which we're not sure at the moment whether driving or flying is going to be the best option.
So I've just given you some painkillers. I'm just going to give you some more. Okay.
It's a really windy day, so it was slightly unpleasant getting here. But that's not really affecting how we convey him. But there's another aircraft already on the pad at Hull, so we need to do whatever's going to be the quickest.
Jim's condition is still being closely watched. He'll be easier to monitor if he's driven to Hull Royal Infirmary.
I'm wondering if he's knocked his head and had a little fix. He's bitten the lip, which could account for the oddness.
Jim will be in Sarah's care until he can undergo a brain scan. His injury may yet turn out to be serious. After days of heavy rain, Yorkshire is drowning with some of the worst floods in years. On the air desk, Daz is watching 999 calls coming in from waterlogged Doncaster.
Here we go. This might be one. Caught in a ditch in the water. Newton. Yeah, I'll set you off on this. Yeah. It's gone into it now. 85-year-old in a ditch.
He's scrambling HeliMed 99. Not far from base, an elderly motorist is in danger.
Happy in the back? Roger, lift it.
Dr. Chris and paramedics Alan and Pete are on the case.
Well on our way, we've got about 10 miles to go, 5 minutes.
Since yesterday morning, Yorkshire's seen a lot of flooding. There's been over 100 millimetres of rain. There's been weather warnings across Yorkshire and in some areas for a threat to life. So the reports are that this patient may be trapped in water, which would certainly fit with the threat to life. Incidents involving water can escalate very quickly. Water mildly above the ankle level can sweep you off your feet quite easily.
They're patients in a car close to a village cut off by floodwater.
It's just wet, wet, wet everywhere. And there's pylons down pretty much every one of those roads. Yeah. Can't see anybody else.
The team are carrying life jackets as a precaution, and they're preparing for the worst.
Showing on the map there's a few irrigation ditches around Chumfrey Lane.
But finding the patient is proving hard.
You go back to the grid, which is Complete Lane and Pinfold Lane.
The caller can see you in the air, and the location should be just southwest of the village of Moss. Over.
The patient's trapped in a red car in a swollen drain.
Yep, I got it. Right. What about that Menage? Is that looks fairly clear? There's something in the middle, but I'm not sure if it's just...
It does look fairly clear, doesn't it? Let's give it a go. I'll make the post there. If it starts lifting, then we'll overshoot and go around again.
Roger that.
Scott's landing in a field next to the car.
Okay, happy down left?
Good left at the moment.
Okay.
Nothing saying wires-wise.
I'm happy to
clear the fence, Chris. Yeah, you clear the fence.
Yeah, I'm pretty happy, Tail.
Still not moving.
Still happy?
Yep. Good left.
Still happy. Still happy.
Good left.
Okay, we all good?
Roger that.
Chris and Al are heading out to assess the patient.
Hello. How are you doing? Hello, dog.
84-year-old Jan Evans lost control of her hatchback and slid into the flooded ditch.
Have you hurt yourself? You hurt your kidney? That's very specific. Right. Right. Okay. How fast were you going? Not so fast.
5 minutes, 5 miles.
Right, you just slid. Right, okay, no worries.
It looks like Jan was taking her dog out for a walk when it happened.
Come on then, sweetheart. Come on. There you go. Come on then. Just quick look.
Local residents found her.
As far as we know, she's just come around the corner, dropped herself down into there. Because we've got so much flooding, it might be a little bit easy on the eyes or something silly like that.
She comes down here every single day.
Yeah, she comes down a lot with the dog, so it's obviously just had a little bit of a mishap and dropped into there and got herself trapped against the hedge, unfortunately.
Her car is moving. Water's seeping in the driver's door.
Right, so just put some weight on the back of this car. It's a bit wobbly.
Local paramedics and firefighters have had to take a major diversion because of blocked roads in the area.
What we'll do is a fire brigader here, so we'll just get them in.
So, little old dear, she's 80-year-old, coming down here, just lost control, ended up in the ditch.
Okay.
But I think his plan would be stabilise the vehicle and try and just assist her out. No cutting here.
The team need to keep Jan calm. It's a stressful situation for her.
What we'll do is you just lift your arms up. We can use this to help get you out, you see. Right, okay, that's fine. We'll wait and get a couple of firemen in as well.
If that fails, can you relocate the vehicle into the road for us?
You feel okay? You're a bit short of breath, is that normal? Yeah.
That's why I've got a nebulizer.
Oh, you got your nebulizer in the boot there? Yeah.
Jan's door is jammed against the hedge.
Let's just get out. Yeah. This is Pete, my glamorous assistant.
Hello, Pete. I'm good like this. What's your name?
Jan.
Hello, Jan. Right. So I think we're going to try and get you.
Right, so if you get that one, Pete, put your arm up so Pete can come under your arm there, and I'll get this side. There we go. Okay.
Al's bedside manner seems to be reassuring Jan.
We'll give you a little hutch. There we go. That's it. Right, can you bring your leg across? Yeah. That's not a phrase Pete's heard for a while because he's just got married.
I'm not married. I'm not used to that anymore.
All right. That's it.
David, I've got you.
I've got severe arthritis. So
Okay.
All right. We're going to go on a three.
It hurts me.
Yeah.
There we are.
I'm going to fall.
You're not going to fall. We've got you.
We've got you.
How do you feel? You all right? Just take a minute.
Take a minute to get you.
How do you feel now?
Feet down.
I don't know the hand I've got.
Does it hurt anywhere?
I've got you.
Does it hurt anywhere?
Only my kidney.
Only your kidney.
Oh, bless you. All right.
Pop yourself onto there. Look, get your bum just there, and your feet there.
Well, where am I going?
Just here, love.
Just sit your bum and come down. Turn around to face this handsome young man here, look. There we go.
Jan's out of danger.
Oh, don't worry about it.
There you go.
Well done.
Now she's safe, Jan's breathing is returning to normal. She'll be checked over in the back of a ground ambulance. to make sure a flight to hospital isn't required.
Give her a quick check over and make sure there's nothing you're concerned about before we go, but otherwise we'll leave you to it. But if there's anything you're worried about, let us know. We'll fly her.
So there's just water everywhere around this area, and that in the initial sort of flash flood phases, you get these people who get stuck in the water, people stuck in the cars, people unable to get out of where they work or where they live and all that kind of thing. And there's this kind of rescue element to it. But as time goes on, so onto the second day now, you start getting the kind of secondary effects of flooding, which is things like this, where, you know, the roads are all waterlogged and you know, there'll be people who are unable to get out of the houses to get the medication. So it's sort of, flooding starts off as a kind of very rapid kind of sort of rescue type event, and then it's sort of, as the water expands, it becomes much more of a kind of long-term thing.
It's time for the team to return to base.
9-9, clear on sea. Life jacket's not deployed, over.
Jan's on her way for a checkup.
Hello.
Thankfully, Jan didn't require any medical treatment. She'd gone out to take her pet Lily for a walk.
To be quite honest, I was more worried about Lily than me, because she is so attached to me that she panics when I'm not there.
Firefighters managed to pull the car out of the ditch, and she's now back on the road.
I wouldn't have minded, but it's been a brand new car, I'd only just picked it up. And I thought, oh no. Then I couldn't get out because the door was against the grass, the bushes.
Lily's none the worse for her experience.
What have I got?
Local people looked after her until Jan was released.
But fortunately a friend of mine was there and she knew her, so she brought her home for me. And it was good to see her. And I said to her, we've been on an adventure, Lily. Not a good one, though.
He's gone?
Yes, he's shaken up.
Yeah.
And he's very, very upset.
The student pilot who vanished after his helicopter crash was later found unhurt. An accident report blamed the crash on his attempt to reach a jacket left on the passenger seat.
He's hit the trailer over, but he's then hit his head, and I believe he's gone unconscious.
Tractor driver Jim needed 24 stitches in his head and suffered severe bruising. But happily, he was back in his cab 3 weeks after his accident.
So he had chest pain, and before an ambulance came and then he arrested?
Yes.
Okay.
Tragically, doctors at Sheffield Northern General were unable to save lorry driver Dave Hutton after he collapsed with a massive heart attack. His devoted family later thanked all the people involved in his resuscitation, and they agreed his organs could be used for donation, saving 2 lives.